Medical Innovation 2010 is a collaboration between the University of Oxford and the George Institute for International Health, and it will bring together experts from around the world with an interest in how innovation can improve the quality of healthcare for populations around the world. It's set against a background worldwide where we're facing restrained or reducing healthcare budgets, increasing healthcare demands, and yet an environment in which it's politically and socially unacceptable for health care services themselves to decline in quality or in quantity. So innovation has an essential role in helping to maintain standards of health care around the world. This is not going to be a change by minor alterations in the current systems and procedures. We really need to look at fundamental changes in the way we deliver healthcare. So, for example, we have to question some of the basic axioms, like whether or not, for example, medical practitioners are a necessary component of the delivery of primary healthcare to populations around the world. In many populations around the world, of course, this is not contentious insofar as there are not enough doctors to provide health care for the foreseeable future. But clearly for countries such as the UK or indeed for Australia, this is much more contentious. But the reality is that with access to modern aids, for example, medical decision-making aids, it's quite possible that a much broader range of healthcare practitioners could deliver affordable, effective and safe care, and we really need to explore these possibilities. Well, I think we have to address the question of whether or not hospitals really should remain central to our healthcare planning and our healthcare budgets. The current system that we have of hospital-focused healthcare is really a remnant of our history in the 20th century, when many common infections or simple conditions such as high blood pressure often resulted in hospitalization because there were no effective treatments to manage patients out of hospital. Now, in the last 50 to 100 years, this has changed dramatically, and we have a huge armamentarium of drugs and approaches to care that allow people to be maintained in the community. And I think we need to change our focus much more to the management of disease and disability in the community and outside of hospitals, and change the budget and change the strategy and change the priorities accordingly. Research has a key role in innovation. It really has to underpin the safety, the effectiveness and the cost effectiveness of any new programs that are introduced. Too often innovation is frequently driven by financial or political necessity rather than by good evidence about what the impact of innovation is. So we need to really base, I think, healthcare in the 21st century on much stronger evidence than we've had in the past. And here I think the tertiary sector, universities, medical research organisations around the world have an enormous role to play, both from the medical and the social science perspective, in providing robust evidence that can guide policy and practice around the world, not just in high-income countries, but also, importantly, in low-income countries as well. We envisage that Medical Innovation 2010 will explore some of these major issues and will hopefully come up with a new range of ideas that will be of relevance to policymakers, to healthcare providers and indeed to healthcare researchers globally.